When you mention the term superbug, many people might immediately think of MRSA, but it's another bug that has healthcare professionals worried. It's called C. diff, and many doctors fear it may be a bigger threat than all other superbugs. Here with more information is Dr. Daniel Kalla, an emergency room physician and author of the medical novel Of Flesh and Blood. Dr. Kalla, thanks so much for being here.
A pleasure to be here, ma'am.
So it's known as a superbug. It's called C. diff for short. What is it exactly?
Well, the Latin name is Clostridium difficile, but it's a bacteria that's been around for a long time, but it didn't become a big problem in humans till we started using antibiotics, because when we give patients antibiotics, we kill off not only the bacteria we're trying to kill off, but healthy bacteria in the gut. And this C. diff that also lives in the gut can superinfect and cause a really terrible gastroenteritis and make people very sick.
Well, you hear a lot about MRSA, and you mentioned that C. diff has basically been flying under the radar for about a decade now. So how does it compare to MRSA?
Well, it's really, there's evidence that MRSA, at least in hospitals, has stabilized or on decline, but superbugs, first of all, are bugs that are resistant to multiple antibiotics, and now C. diff has become one of those, and it's a growing and growing threat in the hospitals. And the problem is, once it gets a toehold in the hospitals, it's really hard to eradicate, because it can live in spores, can live anywhere. Despite the best cleaning efforts, it can be almost impossible to get rid of, and it can spread really quickly among sick patients.
So what are the symptoms?
Well, the symptoms are typical of sort of gastroenteritis or stomach flu, with diarrhea, vomiting, abdominal pain, but it can go on to cause severe life-threatening dehydration. It can cause intestinal perforation, it can cause all kinds of terrible complications, kidney failure, heart attacks, and so on. And unfortunately, it is very contagious and tends to hit the sickest people hardest.
So if it has symptoms similar to the flu, is it often missed?
Yeah, exactly. Like, especially early on in an outbreak in a hospital, they can assume the first couple of cases are just forms of flu from the community or other kinds of common bacteria that cause these things.
So it's prevalent in hospitals. Is there a certain group of people that are more at risk for this?
Yeah, the people who are most at risk are the elderly and the sick. So people in ICU settings are very much at risk. People on antibiotics, because they're already suppressed, and anybody who has immune suppression of any kind is at risk of picking this up. Ironically, it's caused by antibiotics, but also treated by antibiotics for people who get it. So
is there a win-win here? I mean, if you catch it early,
Yeah, well, exactly. You want to get on top of an outbreak, because, as I said, once it sticks in the hospital, there was an outbreak in Montreal. It took them a year to get rid of, and they had 1,500 infected patients. So the idea is to recognize it early, isolate the patients, separate them, wear gowns and gloves and masks, and do your best effort not to let it spread in a hospital.
One of our producers' grandmother just had it, and I know it can have a lasting impact. Yeah. Tell me about that.
Well, if you get sick enough with it, it can shut down. You can go into shock, and so it can affect any organ that you have. For instance, people can go into kidney failure because their kidneys don't get enough blood supply, or they can have strokes or permanent brain damage because their brain doesn't get enough supply of blood and nutrients.
That's scary. How do you stop the spread of it?
Well, you have to have surveillance, so early recognition of it. You have to respond quickly to it, and treat patients appropriately and aggressively, and separate them, and then hope for a lot of luck.
And how about hand washing? Does that play a role?
Oh yeah, thank you. Thank you for reminding me. Before we get to super antibiotics, there's a very simple message that the very best thing any of us can do for any infectious disease is to wash our hands. We spread most infections through our hands. Our hands are our portal to our blood systems and our lungs and our stomachs, and if we can wash our hands, you can cut down exposures drastically to any infection, including superbugs.
Okay, well, on the side, you're also a novelist. I don't know how you have time to do all of these things, but you just wrote a book, Of Flesh and Blood, and you basically said you were destined to write this about superbugs. Why is that? Well,
because in my practice in the last 15 years, I've seen bacterial infections that used to be easy to treat, with common antibiotics become more and more resistant. And as I said, this thing seems to be flying under the radar. I think we're going to see, some people are worried we're going to go back to a era of what we call the post-antibiotic era, where we can't treat infections anymore because these bacteria are so resistant to antibiotics. And this really concerns me, and I'd love to I think we need to raise awareness of it. And so the novel itself tells the story of this legendary hospital, a kind of West Coast Mayo Clinic that was built by one family and is still run by this medical dynasty, but it's under a crisis today The characters are under crisis, but the biggest threat it's facing is this superbug infection with C. diff that's taken hold of the hospital and threatening to shut it down for the first time in 100 years. And it sort of talks about how the characters and doctors are fighting to ward off this infection and keep their hospital going.
Now, you also mentioned the Spanish flu pandemic from 1918 in the book. And do you think there's anything in today's society that has the possibility of reaching something like that on that scale?
Absolutely. I think, I think fortunately our last pandemic, the H1N1, was very, very mild. It turned out to be far more innocuous than many people feared. But the Spanish flu that hit in 1918, as you said, was the single worst natural disaster to ever hit mankind. It killed 3 to 6% of the population, and mainly young, healthy people, in a matter of 6 months. Before we had air travel, it spread from Tahiti to the Arctic. I mean, this thing was a calamity that we have never seen since, and we don't quite know why it was so bad. There's lots of theories, but we haven't seen it since, so it could come back. And one of the fun things, fun might not be the right word, one of the interesting things in this novel is because there's a big historical section, I was able to explore how the hospital responded and the community responded to the Spanish flu in 1918 compared to how it's dealing with the superbug outbreak now, and then go back and contrast the two. But there are a lot of similarities. These things might not be any easier to treat now than they were back then.
Dr. Kalla, thank you so much for being here.
Thanks for having me.
All right. Again, Dr. Kalla's novel is called Of Flesh and Blood, in bookstores now. And don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.